Hi, my name is Elizabeth Hopkins. I'm the branch manager for Visiting Nurses Home Care in Cobleskill. So I am going to talk to you briefly about the personal care aid activity reports and what we're looking for from a clinical standpoint as a patient care aid. It's a huge responsibility to make sure that they're filled out completely, that they're filled out properly, and that you follow your care plan. The most important thing about filling them out is obviously looking at the care plan and what the nurse has assessed as wanting as things that need to be filled out and need to be completed. The different parts of the personal care plan activity report include personal care, household tasks, nutrition, activities, and then also there's under special precautions, there's items on there that need to be filled out that obviously are very important. You want to make sure that any of the special precautions, which include oxygen, blood glucose, reminding to take medications, catheter care, emptying the drainage bag, elastic stockings, the brace and appliance, are reviewed with your nurse manager before you perform any of those tasks. So just to start, under personal care, there are different sections of, there's different tasks that need to be performed. Includes bathing, oral hygiene, shaving, hair care, hearing aids, hand and foot care, dressing, and that includes upper and lower extremities, toileting, changing any kind of incontinence products. It says diapers, depends, but we'll refer to them as pull-ups or depends. Pericare, skin care, and a lifeline. Personal care is definitely as a PCA, that's a level 2. So you think of what you want to, what you have to perform during your duties as a personal care aide. If it says bathed, obviously that includes either a bed bath, a sponge bath in the bed, or includes a shower. So you want to make sure that R is refused, F is family, and X is completed. Again, if you have a client that's continually refusing any kind of personal care, you want to make sure that you're notifying your nurse care manager. Oral hygiene is very important, and again, it doesn't break apart any kind of specifics as far as denture care. So you want to make sure that under oral hygiene, if it's completed, and you have any concerns, for example, if your client has any broke or loose teeth, you want to make sure you contact your care manager or branch manager as well, nursing supervisor, because obviously that's a task if you can't complete it because there's anything going on. You want to make sure that you're calling your nurse manager. And the other items are pretty self-explanatory, shaving, hair care, hearing aids, hand and foot care, and that includes lotion to the extremities and also an inspection. You're always looking at your client's skin to make sure if there's anything that's not intact. For example, if you're looking at their legs and there's like a blister or an open area, you don't want to apply any kind of lotion and you don't want to touch any non-intact skin. And that's a reason why you would call your nursing supervisor. Dressing is obviously, you want to make sure that if the nurse assesses the task of the client needing to be dressed, you want to ask them beforehand if they want their clothes picked out. And if you're noticing that they're having a hard time with the task of picking their clothes out, that's something obviously you want to let the nurse manager know, because obviously that's something they're struggling with. But that said, it includes your upper and lower extremities. Toileting in itself, that can include a client needing a bedpan if they're bedbound, needing the commode if they're a stand assist to the commode, or if they're just on a toileting schedule and they just need assist going to the bathroom. So if you're helping with toileting, obviously that's something that family may do as far as if they're bedbound, but I can see that as being a task that does need to be completed almost every level 2 visit. And again, if they're refusing to let you change their depends or their pull-ups, that's something you want to call your nursing supervisor about. Pericare is very important. Again, with our frail elderly population, it's very important that you perform pericare and do it well. Again, if they're refusing any kind of pericare and that's on their care plan, You think to yourself, are they doing it themselves well? Do they have a peri bottle? Do they have a system in place where they're performing their peri care themselves? Do they prefer their family to have it? So you put an F for family. But again, if they're refusing it and you're noticing they're not doing the task well, you want to make sure you're calling your nursing supervisor. Skincare, again, that's a very important task, being a personal care aide. You want to make sure that, again, any non-intact skin, like even a bump or a bruise you're noticing, especially if it's an area that you're normally not used to seeing bruises, you want to report that to your nursing supervisor. And again, any open areas. Again, these could be pressure ulcers, or it could be a venous stasis ulcer. There's different types of reasons why one of your clients may have non-intact skin. But that said, that's up to, you just need to notify your nursing supervisor so that they can either assess it, call the family, or notify a physician. And again, the PERS, which is a Personal Emergency Response System. I'd say most of our clients have the lifelines, and the reason they have these obviously is to call for help when there's no one available. So the important part about a lifeline is if you're noticing that you have a client who is leaving it on their bedside table, if they're leaving it on their walker, you want to encourage them to wear it at all times. If you notice that your client's not wearing them all the time or they're taking them off frequently, that's a reason why you want to call your nursing supervisor. Again, you not only want to make sure they have it on, but if you're looking at the actual the console itself and it's not lit up, it's not plugged in, you want to make sure you call the nursing supervisor, and they may advise you to try to test it to see if it's working. So under personal care, there's a lot of responsibility, a lot of tasks, and again, the nurse will assess if the tasks need to be done. Again, if you're going into someone's client's home and it's not on the care plan, but you're noticing they're having a hard time, applying lotion to their legs, their lower legs, which is pretty common. You want to make sure that you call your nursing supervisor, and it may need to be added to the care plan. Again, as a personal care aide, you're a very important part of the team. The nurses, we do go out, we do an assessment, we grab a snapshot, but people do decline. We go out every 3 to 6 months sometimes for some clients. And again, following the care plan is very important, but again, if you're noticing any changes that need to be done to the care plan, you want to make sure that you call your nursing supervisor. Other items that are on the aide activity report for the personal care aide include household tasks. And household tasks are very important to perform as well. Again, having a clean, safe environment is one of our goals for our clients. So cleaning the client's area is the first in the AAR. And again, you think of where the client's area is as far as if they live in a home maybe with 4 or 5 other people, you want to make sure that you clean their bedroom. If they have a certain bathroom that they use, it's important that you make sure you clean those areas. Again, if you have a client who lives in a home with multiple people, you just want to clean their area. Again, if you need any clarification to what is considered the client's area, you can always reach out to your nursing supervisor. I think I've said that a lot. It is important to make sure that the nursing supervisor is involved and you're all on the team together. Washing dishes, making their bed, changing their bed linens, pretty straightforward. Laundry can either be done at a home, or sometimes they have to be done at a laundromat, or sometimes if someone lives in an apartment complex, they can be done in the facility. Their floors clean, grocery shopping, trash emptied, checking their mail, and then also doing errands. Again, if a client's asking you to do errands every day and you're there 5 days a week, you want to make sure you call your nursing supervisor, because ideally our errands want to be done within usually once a week, sometimes twice as an exception if they have a new medication that's ordered and you need to go pick it up from the pharmacy. But again, if you're doing more than one errand a week for a client, you want to make sure you reach out to your nursing supervisor to clarify that. Again, next is nutrition. Again, nutrition is very important for our clients, especially our frail elderly. Sometimes we need to encourage fluids. Again, if that's on the task plan, if it's on your aid activity report, you want to make sure that you're encouraging fluids throughout the visit. If you're there for like a 4-hour visit, offer them something when you first come in. A couple hours later, see if they've drank whatever if they have like a 6-ounce glass of water and a cup you've given to them, they haven't touched it. That's someone that you may want to just remind them throughout the visit. Hey, I noticed, Mr. Smith, I noticed you haven't drank any of your water yet. It's a really hot day today. Make sure you drink your water. And sometimes they don't always want water. You can offer them something different. Obviously, it's important to make sure that we do, for our frail elderly, encourage fluids. And again, we do have some exceptions to the rule. If there is a client that has heart failure, for example, and they can't, or if they're on dialysis, those are exceptions. But that said, that should be something that your nursing supervisor reviews with you when they review the care plan before you go see that new client. Prepping and serving meals. This is really important for our clients that we see, like maybe for like 4 hours, so we're seeing them maybe just half the day, a couple days a week. Meal prep is huge because we can freeze meals, we can get things ready for a couple days ahead of time. A lot of our clients get Meals on Wheels, they get mom's meals, so they get home delivered meals. But that said, if you do have a client that's not getting any delivered meals, prepping those meals is really important. And again, the serving the meals is sometimes our clients will sit with a relative and have a meal. Sometimes just sitting with them and giving them some companionship during that meal is important as well. Feeding the client. Some of our clients do need encouragement to eat. Our clients with dementia. Sometimes they need assist with, we have one client who's about 61 years old, and when the aides go in, they prep her meal and they do feed it to her. Again, if any times that we feed our clients, we want to make sure that they're sitting upright, in an upright position, either in a chair or in bed, 90 degrees. And then the next is supplements given. We do have some clients that they'll take Ensure or Lucerna, so they do have supplements that we have to give to them. Intake and output of BMs. A lot of the times our clients will have logs in their homes in which they'll have every day, and it says if they had a BM or not. That said, if you've noticed they haven't had a bowel movement in a couple of days, you're going to call your nursing supervisor, or if there's family available who are in the home, you can say, hey, I noticed Mr. Jones hasn't had a bowel movement in a couple days. Is there anything that he needs to be given? Because sometimes they'll be given some prune juice, some stewed prunes. Sometimes the doctors have orders for a medication that can be given. So just keep that in mind. It's really important that we do monitor our clients' bowel movements, especially if we're in there every day. Or even when you're, so if that's on your care plan, if intake and output of a BM, or excuse me, it'd be output of a BM. If that is on your care plan, you want to make sure that there's a log in the home and that it's being written down by staff. And then the next is activities. Activities are very important for our clients, especially the first one is ambulation. So we do have some clients that, we want to get them up and moving. So if they have if they have ambulation checked off under their care plan, you can ask them if they want to go outside for a walk. If it's bad weather, you can walk around the house. So ambulation is really important for an